Hi, my name is Naomi Weisner from BHS Public Health Forum. Today with me is Dr. Nahid Bhadelia. Dr. Bhadelia is an infectious disease physician at the Boston Medical Center, as well as an associate professor of infectious disease at the Boston University School of Medicine. She's a medical contributor to NBC and MSNBC, but more importantly, she's a member of the Brookline High School class of 1995. Dr. Bhadelia, thank you so much for speaking to me, and welcome back virtually to Brookline High.
Thanks so much, Naomi. I look forward to at some point visiting in person soon as well.
Okay, so let's jump into the questions. Dr. Bhadelia, given the high number of cases nationwide and in Massachusetts, what precautions do you think individuals, in particular teenagers, should take to reduce the risk of spreading COVID-19?
Naomi, great question. And we're particularly concerned right now because, right after the Christmas, the New Year, and Thanksgiving holidays, we really saw the cases go up. And thankfully, those have been coming down for the last 2 weeks. But we're concerned now because what we've discovered is that this virus has mutated. And there are a few different mutations that are now prevalent, in many different countries, but all three main ones that we're concerned about that are more transmissible, which means that it's much easier for people to catch that mutation, that infection, if someone else has an infection with that mutation. And so we've discovered all three of those in the United States. And the concern is that February and March, we might see sort of another surge going up of cases again. The best way to protect ourselves is very much what we've always done. Huge part of that is realizing that this is a disease that's just transmitted through us sharing air, right? And so if we wear masks, good quality masks over our faces, both our mouth and our nose, if you've seen, I'm sure you've seen some people who leave their nose out, but a complete covering of the mouth with the masks, as well as keeping a distance, and staying outdoors as much as possible if you can when you gather, and to keep gathering other people not in your household to a minimum, because the way that this virus gets transmitted is if there are people within the same room where one person has the virus, breathes that virus into the air, and the other person is able to sort of catch that infection from the virus that lingers in the air. So wash your hands, wear a mask, stay out of the indoors and crowds as much as possible. And try to spend more times outdoors, but socially distanced.
Thanks for that. We should all keep that on our minds. Since communication is a large component of public health, in an age of disinformation, where should teens go to learn more about COVID-19 or other public health issues?
Yeah, great question. And this has been particularly hard, partly because this has been such a fast moving pandemic and science itself changes. And so recommendations change. As you know, early on, when we didn't know that people without symptoms could also transmit the disease, we were not recommending masks. And once that discovery was made in about March is when you saw sort of a change in recommendations. And that's why I think it's particularly confusing, because as time goes on, we get all this information about vaccines and about what people who are vaccinated can do. The best source of information is still the CDC. The Centers for Disease Control's website has a lot of public-facing documents that are so rich with just, really practical to-dos. But if you're really interested in the science, they link back to sort of discussing what the evidence is. So that's one. If you want more specific information for the state of Massachusetts, the Massachusetts Department of Public Health also has a wonderful section on their website on COVID-19, a lot of which is public facing and very easily approachable.
It's good to know. So everyone's talking about the vaccine. When do you think the vaccine will be available to the general population? Further, does it make a difference between the vaccines produced by different companies, for example, Pfizer versus Moderna versus Johnson & Johnson?
Yeah, very good question. So let me start with availability and who can get the vaccine currently in Massachusetts. So every state has taken a slightly different approach to this. So the way that vaccines are generally distributed is when a vaccine is discovered and authorized or given emergency use authorization, like in this case, the CDC sets out certain criteria of who should get the vaccine and when they should get the vaccine. So in general, the way that we've decided to distribute the vaccine as Americans Americans in the United States is we've started with the highest risk folks within their occupational, experience, so healthcare workers, as well as people who are the most likely to get severely ill and potentially die from this disease. So those are patients in long-term facilities or people over 75. Then there is a larger group of people over 65 and those with multiple medical comorbidities. And then it's general adults who might be, at higher risk. And then it's probably, once we have a little bit more data, and I'll talk about this in a second, teenagers and children. So currently in Massachusetts, the vaccines are open to those over 75. So we're in phase 2 of our vaccination, and soon they'll open it up to those over 65, as well as those with multiple medical conditions. I think that it probably won't be until April or May that you might start getting to the rest of the general adult population. It may be longer for teenagers and for children because there need to be specific trials that need to be conducted, particularly for those who might be under 18 or under 16. And Pfizer and Moderna and some of the other vaccine manufacturers are conducting those studies right now. They're hoping the results will come out by spring so that before you guys start your next school year, you'll have been vaccinated and you should be able to return with a lot more comfort to your parents, I would imagine. So your other question, I think, was about the types of vaccinations. So currently there's 2 emergency use authorizations for vaccinations for COVID-19, and they are from Moderna and Pfizer, and they're actually very similar technology. They use something called messenger RNA technology, which is new technology. However, it is technology that we've been working on for decades. It's just been perfected more recently, and this is the first time that it's been used in such a large sort of setting, but with the population with this infection. And both of those trials, both of those vaccines have gone through these very thorough clinical trials. Even though it's faster than how vaccines have usually appeared, these have gone through a phase 3 clinical trial that's very strenuous, that showed very good effectiveness, very good efficacy. It basically shows that for the most part, if you get this vaccine, you have a 95% chance, 95% of the people who got this vaccine did not develop an infection, a symptomatic infection, or an infection with symptoms from COVID-19. And in all of not just the 2 that are out, but all the ones that are coming out, Johnson & Johnson, AstraZeneca, there's a Novavax vaccine. In all of those settings, vaccines seem to protect at least against severe disease and hospitalization. So the great things about these vaccinations are once they're out and most of us are vaccinated, all the things that you're hearing about hospitals being overwhelmed and a lot of people dying, those numbers, the mortality numbers and hospitalization numbers will hopefully start coming down soon.
That's good to hear. And it's also amazing to hear that all these vaccines were created and manufactured under a year.
Yeah, you're right. It is pretty amazing. And so one of the reasons for that success is, just our commitment to it. And a lot of times vaccines, there are a couple of things that delay vaccine production. One is, you may not know what part of the virus to approach to make it, effective. And so in this case, we had some data from other viruses, such as the original SARS virus and the MERS virus, which are also 2 other coronaviruses, very similar to the virus that causes COVID-19. And so we lucked out because we had that research. And the other thing that usually takes time is money. It's money, it is effort. And in this case, our government invested in something called Operation Warp Speed that basically told the companies, if you find promising technology and you find good success early on in early trials in humans, we will buy a certain number of doses from you, regardless of whether or not they're successful or not. And that gamble really played out because, so far, at least most of the ones that we've seen advanced numbers on have succeeded in bringing effective sort of results. And so we now have doses that were ready to go out the door the minute the trials were shown to have successful results.
Wow, that's great. So let's turn to health equity. So COVID-19 has a disproportionate impact on Black and Brown Americans. How are the issues of health equity being addressed when deciding who gets the vaccine?
Yeah, this is so important. And I've personally been following a lot of the stuff that's coming from the Biden administration's White House's COVID-19 response team. And again, another good resource if you're really looking to get more real-time information is every Monday, Wednesday, and Friday at 11 o'clock, it seems like the White House COVID response website seems to have these, question and answers with the scientists, and they're on Twitter as well if you want to follow them. So what the first is important to go into why this is important, right? So we've talked about the fact that hospitalization rates and mortality rates for COVID-19 are 2 or 3 times higher with Latinx communities, our Black American communities, our I know indigenous communities, and they've been hard hit partly because of the fact that many essential workers are from communities of color. The fact that, in many cases you have situations where underlying health conditions may be exacerbated from just structural, racism within our healthcare system, or lack of equity in terms of ability to access healthcare, and also distrust of the healthcare system. And so all of those things have created a situation that also we want to make sure doesn't reflect in the way that we get the vaccines out. And one of the ways that we do that first is to help address vaccine hesitancy. There's a lot of vaccine hesitancy or concern about the vaccine in more so disproportionately in our communities of color, particularly our Black American community, because of just historical factors. And if you haven't covered this in the history class, the Tuskegee experiment, where the United States government actually experimented on Black American males on how syphilis plays out without treatment. This left these like historic scars and distrust of the government in the Black American community, but also in general, just ensuring that beyond those factors, that factors such as health literacy, the factors such as just, concern about access within the healthcare system doesn't affect people's ability to accept a vaccine or want to receive it. And so the Biden administration has created a task force on COVID response equity, which is led by Dr. Marcela Nunez-Smith. And the ways that they're doing this is, first, they are looking to get good data, right? They're asking all the states to give transparent reporting on who's getting the vaccine. So we have to know what the problem is and where the problem is to address it. The other way that they're working on it is by improving number of places where people can get vaccines. Investing in education about the vaccine itself, investing in organizations that are improving education, but then working on getting the vaccine to where the people are through things like mobile vaccination, vans, or employing community vaccination centers that are federally funded in states in areas that are hard hit within our minority communities. Those are some of the ways that I think that they've been working on health equity, but it'll be good to keep following this, because we want to make sure that we identify discrepancies and inequities as they arise. So one important thing to note, for example, is that right now one of the ways that we're getting vaccines out is going to be through pharmacies. And you'd be surprised to hear in many minority communities, there are something called pharmacy deserts, which means that there are no pharmacies where people live. Or if they're pharmacies, they are pharmacies that, Medicaid, if you're on Medicaid, there's only a certain number of places or pharmacies that you can go to. And so people have to travel farther to get to those pharmacies. And so ensuring that pharmacies that are in those communities are given the vaccines, but also that there are other ways to access aside from just pharmacy, vaccinations would be one way to sort of address equity in terms of administration.
Wow, I've never heard of the pharmacy deserts before.
Yeah, it's like food deserts, which I'm sure you might have heard of that concept. Of fresh food is, so hard to find in many of our urban and inner city communities. It's just, you find packaged food, but you can't find groceries with fresh food that could lead to better health.
Yeah, wow. So we've talked about COVID-19, but what are other health issues teenagers should know or be concerned about?
Yeah, generally, the thing that worries me about, you know, having been a teenager myself, a long time ago, but all of us, because it's not just teenagers or children, but all of us, all of our lives have been disrupted. They've been disrupted by this pandemic. We're away from our friends. We're away from the things that make us feel normal. We're isolated. We can't do the activities we want to do. And so for all of those reasons, I worry about the mental health of our teenagers, just like I worry about the mental health of our children and also the general community. And so one thing that I really I plead and I ask everybody who's watching you, everybody who's in school with you, is to really reach out if you're feeling, down, if you feel that, first realize that these are not normal times, and it's not just you. This is something that we're all feeling. But if you feel depressed, if you feel like you are stressed, reach out for resources within your school. Reach out to there's tons of helplines in terms of helping with that, with the mental health, access to mental health professionals, and recognize that everybody's seeking care. That there is nothing wrong to seek care for mental health, because now is the time for us to take care of ourselves so we can build that resilience, because things may not go back to normal for a few months more. So that's one. The other is the usual things I say. The things that we've noticed, we've seen like uptake of vaping and smoking go up among our teenagers. So absolutely stay away from all of those things, because they lead to long-term medical conditions. And what kind of infectious diseases doctor would I be if I did not stress protection if you're going to be sexually engaged? So all of those other things, and to ensure that you are in good health.
One last question. What career advice do you have for young people that are interested in public health?
Yeah, I think the best is that the greatest thing about public health is that it is a thread that connects every other part of our lives, right? I mean, it is this broad field that covers everything from nutrition to infectious diseases to mental health to heart disease. The advice that I would have is to, when I was at Brookline High, I actually did a couple of different things. I volunteered in a women's health clinic at Brigham, to get a better sense of what that experience was like. I believe I worked in a research lab for a summer to get a sense of sort of what that looked like in public health. Try to seek out experiences, as you're going through life, to see if that this is a field for you. And if you like it, the best way to approach this is, as you start college, is to seek out more formal academic training, see if you like the sciences. And even if you don't, there's other ways to get involved in public health, information technology and its impact on public health, or languages, right? And access and to language specific materials. Like there's so many different things. Communication is part of public health. There's so many different parts of public health. If you don't like the hard sciences, don't let that be a reason you don't go into public health, because there's so many other skills and talents that we could use within our field.
Well, that's great advice. It truly seems like public health is like such an interdisciplinary field.
Yeah. And so I hope more of you, I hope to see more of you further down the road in your career and intersecting with mine. But Naomi, this has been a pleasure. I just say how nostalgic I am for my high school experience just talking to you right now.
Yeah, thank you so much for taking time every day to speak to me and the rest of the Brookline High community about COVID-19 and public health in general.
Thank you for having me.